Stridor in infants and toddlers is a sign of upper airway obstruction and can be life-threatening. A high-yield way to approach stridor in this age group is to classify it as acute or chronic. In this video, we'll use that framework to quickly identify the most common causes of stridor. So starting with acute stridor, the most common cause is croup, which is an infection caused by the parainfluenza virus. And the stridor is biphasic or inspiratory in nature. There are other associated symptoms as well, such as a barky cough, hoarseness, and other symptoms of infection. Then we have foreign body aspiration. So in this, the stridor is sudden onset and it's inspiratory in nature. With the stridor, there might be a wheeze as well, and there will be focally diminished breath sounds. So these two are the cases of acute stridor. Then we have chronic stridor, and the first differential is laryngomalacia. In this, the supraglottic structures are floppy. So the stridor is inspiratory in nature, but a key finding in the question stem will be that it worsens with feeding, crying, or lying supine, and it improves on lying prone. So that's laryngomalacia. Then we have vascular ring. So this is when the great vessels, they compress the trachea. So the stridor is biphasic, that improves with neck extension. Then we have airway hemangioma. This is a less likely cause, it's less common, but this also causes a biphasic stridor, and sometimes there are concurrent skin hemangiomas as well.